On Tuesday, the Lagos State government said at least 5 people had been reported dead in the state as a result of a suspected cholera outbreak.
That cholera remains a significant public health challenge, particularly during the rainy season.
In the past 10 years, cholera has claimed over 6,000 lives in Nigeria, leaving a trail of devastation in its wake. But the Nigerian Red Cross Society is determined to change all of that. From promoting good hygiene practices to providing critical information on prevention and treatment of cholera, the Red Cross is on a mission to stop cholera in its tracks.
Once you observe anything related as part of the symptoms of cholera, it is expected you go to the health center. Finally, I think the person will be referred to the general hospital if the case is positive. And one beautiful thing about Lagos State government is that treatment for cholera for any person that is being identified is actually free. We've been able to have 2 road shows as expected in the program, the work plan. So the 2 road shows took place in Kushofe Division and Etiosa, which we had yesterday. It was a wonderful experience working in these communities.
Here today we are doing cholera sensitization in Etiosa local government, and we are here with volunteers of Nigerian Red Cross Society telling the community about cholera.
And during our stay at Etiosa, we actually were able to detect someone whose son is stooling frequently.
My name is Patik Badebo Yediro.
Okay, sir.
I reside in Ogombo, in the Etiosa local government. About 5 a.m. this morning, my son just woke up from the bed and started shouting, "Daddy, I want to toilet." After 3 minutes, started vomiting. I said, "What happened? Go to the toilet." He said, "Yes. I think must be a cholera." First thing, I gave him salt and some water. After that, I took him to the nearest health center. They gave him treatment. We brought him back home. And right now, the condition is okay. I'm advising mother or father should please extremely careful now and take care of their children. This is real. Within a tick of your eye, you will lose your son or daughter. But all you need to be is extremely careful and take care of your children. Cholera is real.
So you've heard from him, cholera is deadly. Cholera is affecting people. Some people think cholera is not real, but it's actually affecting people all over Nigeria or in different parts of the country. If you sense that your child or anybody in your household has cholera, immediately give the person ORS, oral rehydration salts, and then rush the person to the nearest health facility around you so that you can save that life.
I want to say here that the volunteer remains to be the strength of the Red Cross.
My name is Adagiri Adino Al-Ghazali. The Lagos State Corps serving under the Etiosa local government. As you can see, I am with my fellow volunteers carrying out the cholera rally sensitization around the Etiosa local government. Why I joined the Red Cross is because I love to encourage people to work more on their health activities.
My name is Obidaro Adeshola. I'm a community health extension worker. I work in Iloro PAC under Agege local government in Lagos State. We usually see like 70 to 80% of children on cholera cases. Whenever they come here, they'll be with vomiting and stooling. We see them listen to their complaint. Then we ask them the history of drugs they have been taking. When they tell, at times some of them will not have been taking ORS, but I know it's very compulsory and it's necessary for the case. There's no record of death on cholera cases in our facility.
So we are in Nnabugwu community. Nnabugwu community is in Kushofe local government of Lagos State. Now, Nnabugwu community is a riverine environment. And that's one of the reasons why, for us, as Nigerian Red Cross, through the support of British Red Cross, we have several intervention programs we are doing under the British Red Cross DM program in Nigeria.
For 4 years now, we've been carrying out a lot of activities. And one of the issues they have is the issue of water. Because it's a riverine environment, always flooded, and they are usually having issue with good water they can drink. And one of the key things we are doing as Red Cross is for us to be able to have Red Cross volunteers domiciled within the community. And that's why one of the survivors of cholera in this community was able to get the information needed for her to be able to overcome the issue of cholera in this community.
Orúkọ mi ni Adébáyọ̀ Saidat láti Agbo-Iketu, Agbo-Itiri, ibẹ̀ ni mò ń gbé. Ní ẹnujọ́ mẹ́ta ó ṣẹlẹ̀ sí mi pé ṣe ni mò ń tọ́lẹ̀tì gan mi ìgbádùn ara mi. Àìpẹ́ ni mo rí pé mo wá ń bì, èéfì yẹn náà wá ń gbé mi wá lè sùn mi wá òkè rárá. Wọ́n á ní kán bá ń pe Red Cross tí ó wà ní agbègbè mi pé kí wọ́n wá wo nǹkan tí ó ń ṣẹlẹ̀ sí mi torí mo mọ̀ pé nǹkan tí wọ́n ń ṣiṣẹ́ fún ní ẹnujọ́ mẹ́ta yìí nìyẹn. Tí wọ́n dẹ̀ ṣe bá mi pè wọ́n wọlé, mo dẹ̀ ṣàlàyé bó ṣe ń ṣe mí pé mò ń yàgbẹ́, mo dẹ̀ ń bì. Mo dẹ̀ ṣàlàyé ẹ̀ fún wọn, wá sọ pé kí n lọ ra table water. Gbígbé mo wá lọ ra table water, àwọn gan-an lọ bá mi rà. Red Cross tó wà ní àdúgbò wa ó ní mo pè tó lọ bá mi ra table water yẹn. Ìgbà tó rà dé, wọ́n ra ṣúgà pẹ̀lú ìsebẹ̀. Wọ́n wá wọn ìsebẹ̀ síbí kan. Mo wá fọwọ́ rẹ́ díẹ̀, mo fọwọ́ rẹ́ kúrò, mo wá dà sínú omi yẹn. Mo wá wọn ṣúgà síbí 6. Mo wá fọwọ́ rẹ́ ní síbí kọ̀ọ̀kan yẹn, mo fọwọ́ rẹ́ díẹ̀ kúrò. Mo wá wọ́n sí inú omi yẹn, mo wá pò pọ̀. Ìgbà tí mo wá pò pọ̀, mo wá bẹ̀rẹ̀ sí mú. Bí mo ṣe bẹ̀rẹ̀ sí mú, mo wá ń rí ìyàtọ̀ ní àgọ́ ara mi débi pé gbogbo àwọn oorun tí mi tiẹ̀ lè rí sùn rárá tẹ́lẹ̀ pé mi ń gẹ̀ẹ́tì ara mi. Gbogbo ẹ̀ wọ́n padà wá òkè, ara mi wà òkè, mo wá rọrùn sùn. Àwọn Red Cross wọ́n ṣe mo dúpẹ́ o, mo jẹ àǹfààní rẹ̀ torí kọ́lẹ́rà ó ṣe nǹkan tí ó dáa lára. Kọ́lẹ́rà ló ṣe mí o, Ọlọ́run ní jẹ́ kí gbogbo wa kárí irú ẹ̀ mọ́ o. Mo dúpẹ́ ní ọwọ́ Red Cross, mo dúpẹ́ gidi gan-an ní ọwọ́ wọn. Wípé torí àwọn ni mo gba ìmọ̀ràn ní ẹnu wọn. Lọ́dẹ̀ fún mi ní oògùn tí mo lè lò tí mo fi wà òkè ní ọjọ́ tèmi tí wọ́n jẹ́ kí n kú. Mo dúpẹ́ o, tẹ̀ jẹ́ kí kọ́lẹ́rà kó gbé mi lọ. Àtèmi àtàwọn ìdílé mi àwa rèé o. Kọ́lẹ́rà ò pa wá o, kọ́lẹ́rà ò gbé wa lọ o. Àwọn náà ní oògùn kọ́lẹ́rà o, mo dúpẹ́ lọ́wọ́ wọn o.
Today, we are proud to say that we have recorded a survivor of the cholera disease within this community, thanks to the efforts of our Red Cross volunteer, who helped her know the exact things to do to keep her safe. The Nigerian Red Cross Society, in partnership with the British Red Cross, has been working in this community since the year 2020 to help the people become resilient against floods. The Nigerian Red Cross has been able to help this community gain resilience.
One of the messages I want people to take home from here is that you need to maintain good environment, and also hygiene is very, very important. Washing your hands frequently is not about using the toilet or after eating. It's something that should be constantly done, and it is advisable you have your sanitizer with you at all time when you know you've been to areas that you need to keep yourself clean, or probably you've touched something that may harm or may be harmful. Be careful about the kind of water you drink, where you eat also, and the kind of beverage you consume, especially when you know that those beverages do not have government approval, which we call here Nnabugwu approval, because these are the people that regulate most of the things we consume, whether drugs or water or anything. So please be very sensitive to your health, be very sensitive to what you drink and what you equally eat outside. So I think when you do all these things, and you are going to reduce the risk of any form of infectious diseases. At the same time, you are going to make Lagos very safe and the environment very safe for people and also for yourself. Thank you.